Hello everyone, welcome to From London with Love, with me, Leen Clive, on ALB-UK TV. Today we are joined by Dr. Nadia Yousri. Hello, Dr. Nadia.
Hello, Leen. How are you?
I'm very well, thank you. Dr. Nadia is joining us all the way from Cairo today. Dr. Nadia will talk to us today about a very important topic for women if you are thinking of having a baby or growing your family. So this show is for you. Dr. Nadia is the expert here to tell us more. So would you be able to introduce yourself, Dr. Nadia?
With pleasure, Leen. I'm a triple qualified OB&GY Surgeon and a fellow of the Royal College of Obstetricians and Gynaecologists. I have been working in NHS top university hospitals for the past 22 years and privileged to be a course trainer in the Royal College. My subspecialties experience includes fertility, assisted conception, high risk pregnancy, maternal-fetal medicine, family planning and reproductive health. I'm certified gynae surgeon and also specializing in aesthetic gynecology. So I didn't waste my life then.
So Dr. Nadia is the best expert to answer all the questions, ladies. Dr. Nadia, you're based in London, but you're just now in a trip to Cairo, right?
I am in holiday in Cairo, yeah, visiting my family, and this is my family home. And I feel very comfortable, and my thoughts still in London, to be honest with you. And every day I follow the news about the lockdown, so hopefully it will be relaxing very soon and back to our normal life as before.
We all hope so. So, Dr. Nadia, I will jump straight to the questions. So, you said preconception. So, what is a preconception care?
Very good question, actually. I will answer according to the World Health Organization definition, which is it's self-explanatory, but it's the provision of biomedical, behavioral, social, health interventions to women and the couples before pregnancy occurs. So it's really assessment, medical care assessment before the lady gets pregnant. Why? It aims at improving their health status and reducing risk factors that could contribute to poor maternal and child health outcomes. This consequently leads to improving maternal and child health in both the long and short terms. Preconception care, you can look at it, it contributes to the efforts of public health promoting programs that aim to prevent and protect, strengthen the health from infancy right up to adulthood. So if I give you an example how important it is to take care of the developing child or developing baby, is that 90% of our adult brain develops right from during pregnancy up to the age of 5 years old.
So it's very important. And what is the current practice?
As a consultant obstetrician then, many of the patients or the ladies, if they are not patients, come to see me or visit my colleagues. They come when they're already pregnant.
Okay.
Some of those women attempting pregnancy may have pre-existing medical condition, such as diabetes, hypertension, heart conditions, asthma, epilepsy, systemic lupus, or mental demands, or other risk factors related to age, ethnicity, social factors that could adversely affect their future pregnancy and the well-being of unborn child.
But if they came before and they have these problems, would you be able to assess to avoid, well, I wouldn't say avoid, but help during pregnancy more?
Of course. it's very particularly important for those women to come in before the conscious decision of getting pregnant, because what I would like ideally is to see is the women comes before they become pregnant. This means that the women will we can identify the risk factors, adjust it in a timely manner to optimize the mother's health. This means that the lady will resume control over her life, taking the responsibility, making plan of getting her body healthier and ready for pregnancy.
And is that linked to planned and unplanned pregnancy? So what is firstly planned and unplanned pregnancy for the audience to be with us, like in the flow? What is planned and unplanned pregnancy?
Unplanned, that just lady falls pregnant without any prior preparation or anything, just she intended, decided, and happened.
Okay.
Unplanned, but not necessarily, mostly it's wanted pregnancy. She just decided, I want a baby, let's do that, and that's it, without looking into her health conditions or how fit she is, and is she in her best version of health or not. Planned is really she took the couple, have the conscious decision or decided for sure and discussed the commitments, the future commitments and the financial, including the financial ones. And they said, yes, we agreed and we have a plan to decide for pregnancy. And she looks at herself and the couple, for example, both of them look at their health status. If she's fit and healthy, fine by me, she can improve her condition. You might have some undiscovered factors like she's anemic, for example, or have low calcium or low vitamins or whatever. If she adjusts all even minor things in the body in her nutrition, she will have better outcome. Particularly if she knows that she has got a pre-existing medical condition like diabetes. So if she's got high blood pressure or, we
will talk about diabetes and hypertension because I think it's very important and many women want to hear more about it. But is that why you think we should invest in the preconception care?
Absolutely, I tell you why. I tell you some statistics, Leen. If we know that 40%, nearly half of the pregnancies, and 1/3 of the births that happen in UK are unplanned. Why? So this means that the complication, we know that complications happen more in the unplanned. Okay. This means that the essential health interventions that could be offered to improve the outcome and prevent the complication would be too late and would be missed. So, for example, have got increased pregnancy problem like high blood pressure or diabetes or...
How does it affect the pregnancy?
First of all, for example, you said about how we invest about the preconception. Yeah. Because we are avoiding, if we invest in preconception, what the preconception will give us a control over pre-existing conditions, so anticipation and prevention of the possible complications that could be happening during pregnancy.
Yeah.
So we have the proper time to adjust it. For example, diabetes, which I'm going to mention about diabetes. If she has got fluctuating blood pressure, that's not good for the developing baby, especially if I tell you, Leen, the most important part of pregnancy is the first 3 months of the pregnancy, where, especially between 3 and 10 weeks, where the organs of the baby start to develop. And should be euglycemic, what were the euglycemic, which is normal blood sugar. There is a range of normal blood sugar. So if she has got raised blood sugar or fluctuating blood sugar, that's not good. That has an effect on the baby's development. Another thing, diabetes, as you know, is have got 2 types, type 1 or type 2, but mainly one is deficiency of insulin, either by actual deficiency or is the resistance of the insulin hormone. That's more common in pregnancy because pregnancy has lots of hormones that counteract the insulin hormone. So the insulin is fighting alone against many hormones.
Yeah.
That's why we call pregnancy is diabetogenic. Diabetes itself has got the problem of raised blood sugar, and it's a disease of blood vessels. We call it vasculopathy, which can lead to end organ lifelong problems like nephropathy, retinopathy, which is affection of the blood vessels on the eye, on the kidneys, and also has got problems with the fluctuating blood pressures, the blood sugar, that can lead to increase weight gain, and the sugar level goes high. High sugar level will go to the baby through the placenta. The baby pancreas is not well developed yet.
Yeah.
The baby will rely on the maternal or the mother's pancreas to adjust blood sugar. High sugar level going to the baby will affect, as I said, development of the organs, affect the size of the baby, and affects the placenta. You'll be surprised if I tell you the diabetes will be increasing the level of it will predispose to blood pressure and will cause placental insufficiency. So the placenta is not working well to supply the baby with nutrients and oxygen as it should be.
So it can cause really serious problems for the baby.
Always, because if you have got possibility of, there is a risk of more hereditary or birth defects, 5% or about or more than the normal population risk, because if you have raised blood or uncontrolled blood sugar, she will have low abnormalities in birth weight and development. You have risk of developing complication of pregnancy like blood pressure, preeclampsia, which is toxemia of pregnancy. This will lead to preterm labor and increase the risk of morbidity of the mother and the baby.
Okay. Now, in terms of hypertension, for women who already have problems with their blood pressure, and also for women who don't have problem with blood pressure, but they start noticing that there's something wrong after they get pregnant.
Yeah. Again, the blood pressure is the pressure of the blood against the blood vessel wall.
Yeah.
And there are categories. One of them is pre-existing condition, which the lady knows that she has got hypertension called essential or kidney-related blood pressure, or develops after she gets pregnant. And it's the famous one is preeclampsia, and we know that the risk factors, some ladies are more prone to have blood pressure problems during pregnancy than others, especially, for example, young or extreme of age, young and mature ladies, or for example, the more the weight is the possibility of having blood pressure problem. Family history, her mother has got blood pressure during pregnancy, will have that. Many more. So the blood pressure again is a factor complicating pregnancy, and remember, it all affects the development of the fetus, the development of placental function, the anatomy, proper anatomy of the placenta and function, and sufficiency of the placenta to provide consistently right amount of nutrients and oxygen to the baby. Also, the blood pressure, if it's not controlled, it will cause more problems to the mother later on and the baby, which will end as well problems to the mother and the baby during pregnancy, and the baby as a development, and preterm birth and low birth weight, which is not good at all.
So what are the areas or aspects of pregnancy care?
That's a very good question, actually, because there are, when the lady comes for preconceptional care, we offer many services because, for example, through family history, through history, and assessment and tests we can do, we can cover many aspects like offering genetic counseling, offering controlling of the pre-existing medical conditions, fulfilling screening programs like including cervical smearing or screening for infection or endocrinal problems, giving advices on avoiding some harmful environmental factors and protection against infection, and activation of the infection screen through vaccination. Advices about the suitable nutrition, the ideal weight before pregnancy and weight gain during pregnancy, and what about the supplements, because a lot of controversy about the supplements, and what about the role of exercise in pregnancy. Also, we assess the lifestyle of the lady. For example, we give advices about tobacco smoking, cigarette smokings, or alcohol intake, or illicit drug abuse, which has very bad effect on the baby, to be honest with you. Also, we assess psychomental assessment. We assess the psychomental condition of the mother and give support and protection against some harmful domestic conditions. Also, setting plans to avoid complications that you mentioned, especially that those happen, say she had a previous pregnancy and she had problem with it. How can we avoid preventing from repeating this incident again? Through setting the right surveillance program during current pregnancy. Also, if she needed, we will give her advices about how to enhance her fertility efforts. And if she needed to have time to control a medical problem, then we offer the best way of birth control that suits her and condition at that time.
That takes me to the question. So when a lady should schedule her appointment?
Very good. Yeah. So as I said, once we say that healthy couple make healthy baby. So they have to sit together and decide about the timing they would like to have to contemplate pregnancy, and say, we decided, we agreed the commitments and the work commitments, the financial commitments, and that when we're ready now to have a child in our life. Okay, so that's the time after having the conscious decision of pregnancy. Then, okay, how are we? Are we in the best version, the lady and her partner, not her alone, because it's a couple, it's a co-production. So are we in the best version that we give our baby the best gift of health? Okay, how we know? We go, okay, let's visit an obstetrician. And I'm saying obstetrician, not even GP. Why obstetrician will tell you more. So, okay, so when? The sooner the better.
Okay.
Because, why? Because when we assess the condition, some of the ladies may need adjustment and improvement and empowerment and strengthen their health that could take few months. Some ladies take longer. For example, if we discover, for example, that she is not immune to rubella, which is a very obnoxious viral infection that harms the baby, then she needs to have a vaccination, which is a type called attenuated live vaccine, which shouldn't be given during pregnancy. Okay. So she has to have this vaccination 3 months. So this is one of the requirements, for example. Or, as I said before, controlling blood sugar, fluctuating blood sugar, or reducing her weight to get into the ideal or the best health, because high body index, mass index is not healthy things, okay? Or she's undernourished, need to empower her with vitamins or adjust, for example, iron, which is very famous. She's anemic, for example, or some weakness in vitamin because of reduced calcium level. So we have to provide some nutrition to improve her health to get in the best shape she has as well.
So you talked about the tests she does when she comes to you, but also you mentioned genetic tests. So would you be able to tell me more about the genetic tests, please?
Of course. The genetic, we offer genetic carrier screening, which is the test that can tell whether a lady or the couple are at risk of passing genetic disorder to their baby.
Yeah.
So errors of mutation in their DNA sequence of their genes that can lead to congenital malformation, abnormalities in structures or function of the developing baby. And this could be running through a family, or it's related to ethnicity. For example, we have got single gene, which sometimes the problem happens. A carrier state means, for example, that there are always two genes for a certain trait, always. So if the gene, my gene, always produce one gene goes to the baby, and my partner will have another gene goes to the baby. So my gene, if it is okay, normal, or have got a problem with my gene, it's called single. I will be carrier of the problem. Yeah. If my partner has got the same problem, so the risk of the babies producing a baby with affected problem will be 1 in 4.
Okay.
5%.
So to assess the risk, mainly.
Yes, risk, and of course. And I'll give you an example of the famous single gene disorders that are very common, like in famous example is the cystic fibrosis in Caucasian community, which the carrier state is 1 to 22. So 1 affected to 22 normal. So every 22 person you'll find 1 have got carrier of cystic fibrosis. Or we have got a problem you heard about sickle cell anemia or thalassemia, which is more common in Afro-European community. Also, if you have got other like Tay-Sachs or Gaucher's or inborn metabolic error that in some Ashkenazi communities. So some ethnicity will give you the clue that they might have a problem. Or she knows that in her family there is, for example, one of her relatives was affected by this condition, and she's very worried about this condition could be she will transmit that to her baby. So she needs to know.
But still, this test is for everyone. It's regardless, right?
No, it's as I said, if there is ethnicity. So if there is, for example, Africa.
The genetic test in screening in general, it's for everyone, regardless if it's run in the family or you're aware or not aware of.
You're right. Certain screening tests are for all, especially if there is ethnic background. But there is specific ones. If there is a family background, we need to have a genetic counsel, and we think about the risk of possibility of transmission of this trait. So we do it actually. So we do it. So as you said, there are 2 types of tests: one targeted and one expanded, which looks into various many disorders and ethnicity related. We do it through blood test or saliva, or doing it through, for example, if the couple they need to know. We can do that through natural. If they do IVF, for example, we can take the gametes or the eggs or the sperms, and we test them, what we call pre-implantation genetic screening or diagnosis. Imagine. So if we found a faulty egg or a faulty sperm, we just discard it, or zygote. If they conceived naturally and they wanted still know, she's pregnant now, she wants to know risk of having, or the possibility of having abnormal child, we can do chorionic villus sampling. So this will help the genetic as well as counseling and testing will help them to decide what if and what to do. Not only that the normal screen, but what if they have got family history of problem? How would handle it, and how would select the normal from the possibility of abnormal eggs or zygotes?
Let's talk about vaccination now. So tell me more about vaccination during pregnancy.
First of all, vaccination, there are types of vaccination. The live attenuated against viral infection, they should be taken during childhood, like the childhood rubella, because they are live attenuated, so there's a risk of problem. So you can't give that during pregnancy. At least 3 months, good 3 months before falling into pregnancy. If there is, for example, if she's not immune and she fell pregnant, give them immunoglobulins to protect. Like, for example, the famous one is varicella, which is shingles. So we discovered that she's not immune, but she exposed to a child with shingles, so we give her immunoglobulins to protect. Okay. The famous, there are vaccinations should be done, and the right timing is the preconception time, Leen. As I said, rubella, measles, mumps, varicella, HPV, human papillomavirus. So that's the best time to do that, not during pregnancy, or influenza or COVID-19 now. So all of vaccines should be perfectly done before pregnancy, well away from pregnancy. And that's one of the reasons, one of the important values of the preconceptional period.
Yeah. Now we talked about all the medical problems and what can happen and how can we avoid them. What about lifestyle? So is there anything we need to do to change, like the lifestyle?
I think the lifestyle is the good example of really 100% of the area that you can really, any lady can change and control easily. That's really a good example, because some of the unhealthy habits on the lifestyle can adversely, negatively affect pregnancy. If we can remove that or eliminate this habit simply, so we'll improve the health. For example, smoking. Cigarette smoking. If we know smoking contains tar and nicotine and affects the placental blood flow, which leads, as I said, problem in development, in growth, in preterm labor, and there is increased risk of neonatal and sudden, morbidity of the baby, which is not good because of the smoking. So if we completely quit, that's the time to quit smoking. When? That's the time. And if she needs help, we have got an NHS line, and we can provide her with that. And similarly, alcohol intake. Alcohol is toxic. It's something you put impact on the liver to try to degrade, try to break down the alcohol, not to affect the baby. The baby, if the alcohol goes to the placenta, into the baby. Exactly. The baby liver cannot break the alcohol, so it's toxic. And especially if she has got excessive alcohol intake, you can imagine the danger or the adverse effects on the baby's development. Some of the ladies also use, one of the recreational habits is using illicit drugs or substance dependency, like heroin, cocaine, it's marijuana, etc., etc. This again affects the placenta and causing placenta abruption with detachment, causing insufficiency in the blood flow, causing birth defects, causing even stillbirth. So it's really harmful to the baby. The very, very, very vulnerable creature. You just exposed to many of these toxic, even the adult, it will take time to try to break them down, but the vulnerable baby cannot. So if you can get rid of these, eliminating danger at least, and harmful effect, that's good. That's good in itself.
Yeah. Now, if we move about more diet and nutrition, to end the show with, I feel like I don't want to stop the show, but last thing, and I think it's really important, diet and nutrition for during pregnancy, because I know it's like the sickness wouldn't help, and the hormones changes wouldn't help. So what advice do you give for women?
Before I talked about nutrition, there is something very, very important and vital, Leen, for the lady to remember. There are always a key points in this subject. The folic acid supplements.
Yeah.
Folic acid, proved by studies, should be taken 3 months before falling into pregnancy and 3 months after conception. This is valuable to protect against birth defects called neural tube defects, spina bifida and all these things. So that's essential. There is no controversy on that. And the minimum to 400 microgram of tablets, okay, 0.5 for example, that's fine. Especially if taking medications, drugs like for anti-epileptic medication that really, or diabetic, so there is a risk of birth defects. So folic acid is, you can increase the dose a little bit. So that's for the supplement. Okay, yeah. And have vitamin D or iron or whatever if she's insufficient. If we do the blood tests and we saw that she's anemic, for example. Regarding the nutrition, she has to have a normal, balanced diet with preferably high protein content, of course, rather than high carb content. So essential unsaturated fatty acid like omega-3 is very important. So I'm not really going into the details of how to eat. But fish, yes, for example, and but everybody knows the right nutrition or the source of high energy proteins, for example, in lean meat or in fish, but they have to have some precautions about the fish, because some fishes coming with high content of mercury, or they have to cook the fish very well because of the possibility of to avoid foodborne infections. There are foodborne infections coming. Yeah, and avoid handling pets. For example, clutter, like the cats. They are well known to carry or convey infections like toxoplasmosis and foodborne like listeria. So if we avoid the harm of the environmental factors, that's itself protection and improvement of the health. So she needs to know that. That's the preconception education. That not everybody knows that.
And you gave us amazing knowledge and advices. Thank you so much, Dr. Nadia, for being my guest today. I'm sure many ladies will benefit from the show. And thank you for taking from your time off on Cairo to join us in the show today.
Thank you very much, Dr. Leen. And I know most of your audience, they don't know that you are really a doctor, medical doctor. Thanks for having me. And hope for the best. Thank you.
Thank you so much.